Life Unrehearsed, brought to you by Caregiver Crosswalk, Dementia Care Consulting. Never roam alone.
And good afternoon. Welcome to Life Unrehearsed. My name is Matt Del Vecchio, specializing in life transitions, downsizing, in the senior living industry.
And I'm Corey Sirota, clinical social worker and psychotherapist, specializing in grief and loss.
Coming right up on the first half of today's show, navigating our healthcare system. It can be frustrating and time-consuming. Where do you even begin if you require care services for yourself or your loved ones? We're going to be talking flu shots as well. Well, we're going to have some answers for you with some valuable words of advice from someone on the inside of our system. Corey, how'd you make out on day one of changing the clocks?
We remembered to do it, so I suppose that's a plus. Start with that. And but now, Matt, look out the window. Yes. It's dark, and we're just starting. Matt and I really enjoyed. The only thing nice about walking out at night after our show in the dark is that the bridge going to be lit up?
That's right. We're just when it's 4. Well, it doesn't help that it's raining in a dark day. We're waiting for the Jacques Cartier Bridge to light up soon anyways. What was good in the morning, normally I walk my dog, good old Zola, our Great Dane, around 6:45 or 7. And last month or so, it's been like flashlight and reflectors. And it was like, hey, wait a minute, it's light. So there is some positive. And
that's true.
Talk about positive. We'll get through this. And if you look at it this way, in 7 short weeks, the days start getting longer, Corey.
You're just chock full of positivity, Matt. Really? This
Gotta be. Come on.
Yes, exactly.
What do we have coming up on the second half?
Well, aside from the clocks changing, we also hit November. That means the beginning of Movember. So we'll be talking with the spokesperson about the changing face of men's health. There's some phenomenal programming out there, and I'm looking forward to hearing more specifics about it. That's coming up all after the 4:30 news.
Yeah, looking forward to that. All right. You might have heard at the beginning here, one of the co-sponsors of Life Unrehearsed is Caregiver Crosswalk, owned by Claire Webster. Good friend, good colleague, and Claire also hosts a really unique McGill Cares webinar. And she had a really interesting guest a few weeks ago talking about navigating the healthcare system. Reached out to Claire and says, yeah, you absolutely have to talk to Zelda. And that's what we did. Our healthcare system is not perfect, as we can all attest to, I suppose, but it can certainly be challenging when trying to navigate our system. So to help make our lives just a little easier and provide a better caregiving experience, we have Zelda Freitas on the line. Zelda is coordinator of developing practices in support of caregivers at the Center for Research and Expertise in Social Gerontology of the CIUSSS West-Central. Zelda, welcome to Life Unrehearsed.
Thank you, Matt.
Well, thanks for doing this, coming here on a Sunday. I must preface this by November 1st is also the start of National Caregivers Week. So, Zelda, we're so glad that you could join us on the beginning of National Caregivers Week and provide us a little guidance and help here. So, let's first start with what types of services are typically assessed or accessed, I should say, from our local CLSCs.
So, your local CLSC, which is your local home care team, it can provide a variety of care at home for individuals who are in loss of autonomy and also to caregivers. Care can be hands-on, such as care with personal hygiene or medication monitoring, but it also could be nursing care or psychosocial support, mobility and home and personal safety from a rehab professional, referral to other resources and programs. They are like the gateway to centers, temporary respite and long-term care facilities, just to name a few. Think of it as a mobile, multidisciplinary healthcare team.
There's certainly a lot of services out there that are so vital, and we're grateful that these organizations. How does one go about getting these services?
Well, I think the first thing to note is that to reach the home care services, you need to call your 811. And 811 has an info social responder. They have the nursing responder, but they also have a social responder. And that's the person that you would be wanting to speak to with regards to a home care evaluation. The key words when you're speaking to them is really talk about home care evaluation of needs. Have as much information as you can on hand in terms of healthcare providers, recent hospitalizations, anything that could help make it clear to them what you may need and the urgency of your situation. Just to remember, family and friend caregivers can call as well on a person's behalf, but they must have the consent of the person who needs the evaluation in order to proceed. And again, it's consent for the evaluation and not for services that might follow, but really it's for the evaluation itself. Know there are wait lists and the best way is to try to plan it ahead as much as possible.
And, talking about wait lists, Zelda, we do want to talk about that. And I suppose your lives were made a little bit more difficult in the last few days with this whole hacking episode of your particular CIUSSS. And I'm sure that's affected things, and I understand no internet. Hopefully that's going to get resolved quite quickly. Has there been any update on that part? Have you heard anything? I know I'm putting you on the spot here.
Yeah. The last I heard is that they're working very hard on it online, but rest assured that even though they are offline, as we say, they are very capable of providing the services best of their ability. They just have to go back to, the good old-fashioned writing things by hand and so on. Yeah,
I'm sure not easy, and I know everyone's working overtime trying to get through this unexpected and very challenging event. Now,
absolutely.
When we'll call it on a little bit more normal times. And Zelda, I don't know what normal is considered, whether there's hackers and but in more normal times, what are some of the expected wait times to get an evaluation and begin some of these services?
Okay. Well, wait times are much harder to comment on in a way that would be helpful to your listeners, but they are quite variable, actually, from one CLSC home care service to another, and from one CLSC to another as well. And that's partly based on the number of requests, the staffing, and the service that's being requested in terms of the priority of that service. For example, nursing care could be provided, say, within a week if that's what's necessary, but there might be a wait time for another service, for instance, such as a nutritionist. So what you should expect is a wait time before a home evaluation to take place. So plan ahead, like I said, if you can. But once the request is made, I think it's really important for listeners to know that they need to advocate. And one way to do that is, if you know that there has been a request made, call the CLSC, call the home care department, and find out where you might be on that wait list, what can be the expected time, and try to get an idea of what's going on from their end as well. So communicate with them, even though you might be on the wait list or the person you're caring for is on that wait list, because they do vary quite a bit, like I said, and it's important that you communicate your needs clearly to the person who's in charge of that wait list.
That's Zelda Freitas from the CIUSSS West-Central. She's talking about navigating the healthcare system. You're listening to Life Unrehearsed with myself, Corey Sirota, and Matt Del Vecchio. What about, Zelda, about home care services after being discharged from a hospital? How does one go about getting that?
Well, if you have services in place already, for instance, if you're already a client or a user of CLSC home cares, they usually are aware if you've been hospitalized. And the reason for that is that our services are set up in a way that we call them corridors of services, meaning that the hospital and the home care services and your GP, your family doctor, there is communication that can go on between those three systems. If you allow, of course, with your consent. So if you are hospitalized and you're already known to a home care program, the team would already know that you're in hospital, and they are already working with the team at the hospital to ensure a good discharge and a good communication. So your needs can be followed up when you return home. If you're not known to the home care team, then the hospital could make a referral to the home care team for your follow-up visits or whatever it is that you might need. We all know that discharges are happening much quicker. People are returning home quicker from hospital to heal at home. And so a lot of times it's the hospitals that make the referral to the home care team. If you're a family and friend caregiver, or if you're an individual, yourself that might need care, make sure you speak to the team at the hospital prior to going home and inquire. Ask them if there's been a request made, or if you feel that there should be one made, ask them and ask them to make that request on your behalf. So the helping, you need to be able to help. If you're the helping person, then you need to make the team know at the hospital what your capabilities are as well. So for instance, if a person who's hospitalized needs more services during the day, and you're a working caregiver and you work during the day, that's important for letting the team know that. So they're making their appropriate requests to the home care team based on the information that they have. So communication is key.
Absolutely, Zelda, and we see it firsthand, Corey and I, also working with the healthcare systems, and you really do have to advocate, and don't be afraid to advocate, obviously in a respectful way. Now, Zelda, flu shots are a huge issue these days. And in fact, we're going to ask you for a bit of advice on how to get your flu shots.
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back to Life Unrehearsed. I'm Corey Sirota, along with my co-host Matt Del Vecchio, and we are talking to Zelda Freitas with CIUSSS West-Central about navigating our healthcare system. And you are just providing us with, I just said it off air to Matt, what amazing information, what so clear, so concise, so important. So along those same lines, we're having the debate. I'm hearing about flu shots being a nightmare if you want to go get them. Any suggestions you have about how to go about reserving a flu shot?
Yeah, I'm not a flu shot expert, but from what I know, this year, unlike other years, right, due to COVID restrictions, individuals have to make an appointment to have a flu shot. I know that pharmacies are also giving out flu shots as well, and in the past, and also in nowadays, also family physicians are also able to give out flu shots. But if you want to have a flu shot, I would suggest that you look at your regional CIUSSS website on the island of Montreal. You need to register online for an appointment, or you can call the number listed on the website and make an appointment by phone. There's also public announcements in local print media, for instance. So check your local newspapers. There's usually a full-page ad taken out by your local CIUSSS, and they will give you some information available with regards to where to call and so on. I just heard actually this last week, you probably heard as well, that our local public health department announced that they will make it available an additional 50,000 flu shots starting this week to Montrealers. So there was a concern about flu shots. They've now increased the number of flu shots that will be made available. Again, this year they will be prioritizing vulnerable groups first. So individuals living with chronic illness, regardless of age, and older adults are prioritized, as are healthcare providers. So reach out to your local CIUSSS website or call the number that is available and find out how you can book yourself a flu shot.
And Zelda, just on that note, for let's say the seniors or elderly that aren't so technically inclined, they don't know which number to call if they can't look up the website. Is it as simple as calling 811 for some direction as to what the local CIUSSS number would be?
811 is always available to help with those kinds of questions.
Okay.
Absolutely.
Very good. All right, we're going to switch gears a little bit and let's talk family doctors. And as we're seeing, there are many family doctors that are retiring, and it is becoming very challenging to get a family doctor. Many people on waiting lists. And so what is the process? Can you bring us through the process of trying to get a family doctor, Zelda?
Well, like you said, there are a lot of family doctors that are retiring. I actually find myself in that situation right now, and I've had to put myself on a wait list. So the way to proceed with that is that you should go to your CIUSSS website again, and you can register on the Quebec Family Doctor Finder. They ask you some basic information. They also, through that questionnaire, a little small questionnaire that you will answer online, they will prioritize your request for a family doctor. It's very difficult to predict how long you'll have to wait, and because it really depends on the availability of doctors in the area that you live in and how many people are actually on the wait list in your area. But you must register online, and if you can't do it yourself, if you don't have access to the internet, for instance, someone can register on your behalf. Have them sit beside you or give them the information that they need in order to answer the questions that are on this online questionnaire.
Now, Zelda, can you, if you have a GP, a family doctor, are you allowed to go start the process early and apply and get on that wait list? There's three different criteria. There are people that have no family doctor. You can register as a person who is whose family doctor is retiring as well in advance. So you can register in advance to be put on that list. You can also reach out to, that's the third option, is that you could also reach out to your local clinics and see if anyone in the local clinics are taking any new patients as well. Okay, thank you.
Interesting. So once we're talking processes, let's just put you on the spot for another process.
Okay.
What's the process to get a loved one into a public long-term care home, like a CHSLD?
Okay. The process to get into a CHSLD is through your CLSC, or if you are in a hospital, for instance, you can also be admitted from a hospital. So public residential long-term care facilities, as we call them here in Quebec, CHSLDs, are provincially standardized. They are provincially standardized in their admissions criteria. So basically, an individual has to make an application in order to be admitted to a CHSLD. And in order to make an application, you have to reach the level of care that is required for that setting. So therefore, there's a criteria that is associated with the level of care that a person may need. So, for example, you can apply to a long-term care facility only when you require that level of care that is the criteria for that center. There are also intermediate care resources for people that require some care and some supervision, but do not require full-time 24/7 care for people, for instance, that have advanced illness conditions. So you need to apply through a public health care center, so a CLSC. If you're known to a CLSC home care program, that would go through your social service provider or social worker. They will help you guide you through the level of care that's required in order to make an application. So you can only make an application when you actually require that level of care. And that's where sometimes it gets a bit confusing and complex. You can also apply if you're living in a private residential care center, in the event perhaps that your financial situation changes, and you can no longer sustain that. So it's very complex. The system is complex, but remember that you need to have a certain level of care. So there is a criteria, and you must go through a public healthcare provider in order to make an application for a public healthcare facility.
We're talking with Zelda Freitas. She's with CIUSSS West-Central and helping us navigate our public system. You mentioned that there are long waiting lists for CHSLDs. One of the reasons why I started my company, Lianis, was to sort of fill that gap if some people want to go private, either permanently or while they're waiting. And we're very fortunate in Quebec where we do have that option as well. Now, we're wrapping up very quickly. Those listeners beyond the public system, Zelda, what community resources would you suggest we can go to?
There are the number of community resources available, and the first one I would start with would be L'Appui. I'm not sure how many people in your listeners have heard of L'Appui, but it's an actually excellent service. It's a bilingual telephone and resource support line. They have a directory of resources also on their website by region. And their support to caregivers of older adults. So that's a really great resource. Telephone line, easy to access. There are a number of caregiver resources as well through illness-specific associations, such as the Alzheimer's Society, AGI, which is the Alzheimer's Group Inc., the Cummings Center, for instance. So there are a number of community resources that could be accessed as well.
There really are. And, sorry to interrupt, Zelda.
No,
I just want to L'Appui for those that might not have understood. L'Appui. Just excellent. Zelda, thank you so much for joining us. Sorry we have to cut out here. We could talk forever.
Yes.
And we'd love to have you back. But thank you very much for joining us.
Thank you so much for having me.
All right.
Thanks so much.
Remember 811
Remember 811, and that's how you can access everything else you need. Coming up on Life Unrehearsed, it's November 1st. You know what that means? It means the beginning of Movember. We'll be hearing from the spokesperson about how they're changing the face of men's health.